Thank you for joining the call today. My name is Richard Salinas. As you can see, we are HealthCare on call, where the doctor is always in, and we are located in McKinney, Texas. Now, the prices in our healthcare delivery system today state that there's over 70% of doctors' office visits are unnecessary. Over 66% of all ER visits are non-emergencies. There's 50 million plus uninsured and tens of millions underinsured. Now, this statement, everyone pretty much knows somebody in this situation right now where even people that have insurance are making choices between rent, groceries, and basic health care. You know, employers are realizing even more now than ever that their premiums are affecting their bottom line. You know, there's an inefficient overuse of expensive doctor and ER visits, which is actually costing employers over $63 billion a year. Now, the full cost of employee absences amounts to 36% of payroll, and the new studies find that 7 times greater loss due to presenteeism, which is sick employees showing up at work. Now, also since 1999, worker contributions to premiums have increased 168%. Now, the solution for employers, obviously, our program is designed to lower healthcare costs by up to 25%. Our program is there to add a valuable health benefit. Our program boosts productivity. It's also put in place for a healthier workforce, and it's also there to boost employee morale. Now, the National Center for Policy Analysis states that telemedicine has the potential for restructuring medical care in ways that can solve many of these problems while reducing costs and improving the quality of care. Okay, this is our ultimate protection package, and before I go over it, I want to give you guys some information. You know, 60 to 70% of people that go to the ER, urgent care facility, or doctor's office visit, you know, 9 out of 10 times it's something so minor that could have been handled in a different manner, which is why we partnered up with Consult the Doctor. Now, Consult the Doctor gives everyone access to U.S. board-certified licensed physicians by email or by phone 24 hours a day, 7 days a week. Guys, you get unlimited access to U.S. licensed board-certified physicians by phone or email 24 hours a day, 7 days a week, all year round. So it doesn't matter if you're on the road. It doesn't matter if it's 2 in the morning. It doesn't matter if it's 12 in the evening or 12 midnight. Or it doesn't matter. You guys have access to physicians 24 hours a day, 7 days a week, where you can pick up the phone and within minutes, sometimes seconds, you're talking to a U.S. board-certified licensed physician about your symptoms. And if a medication is warranted, our physicians are also able to call in a prescription to one of more than 60,000 pharmacies in our network, where you, the member, will enjoy discounts of 10 to 85% on most short-term and acute care medications. Now, on top of that, we also partnered up with a physician and hospital referral network, which you'll be able to save anywhere from 10 to 40% off at over 400,000 participating physician offices and hospitals. Again, guys, for $29.90 a month, you have unlimited access to U.S. board-certified physicians, which are going to save time and money, so you don't have to go and spend 3 or 4 or 5 hours at a doctor's office waiting to see the doctor when there's a room full of sick people, or you have to take time off of work to go see a doctor. You can literally pick up the phone, speak to a physician within seconds or minutes, and if a medication is warranted, you can go pick it up and go back to work or whatever the case is. But guys, for $29.90, unlimited, and this covers the entire household. Also, we have coast-to-coast vision, which is going to save you 20 to 60% off on prescription eyeglasses, including frames, lenses, and specialty items at participating retail locations. We've also got a vitamin program where you can choose over 400 brands and 12,000 items in stock and enjoy savings of 10% on already low prices. Hearing, you can enjoy access to a variety of hearing programs which provide hearing aid discounts from 15 to 35% in retail locations nationwide and discounts of 40 to 60% through the mail order program. We've also got lab and imaging services, which offers discounts of usual charges for blood tests and all other lab testing. Members receive discounts of 10 to 60% off usual charges for MRI, CT procedures while utilizing credentialed radiology providers. Also, we have our Aetna Dental Access. You know, Aetna is a very popular company and very well-known name. So we partnered up. We brought on the Aetna Dental Access portion for people that do have dental insurance and for people that don't. And in most instances, members may save up to 15 to 50% off on services from general dentistry and cleanings to root canals, crowns, and orthodontia. This will help you use more of that specified coverage, whether it's $1,000, $1,500, or $2,000 a year. This is going to help you put more of that money back in your pocket so you can get more access and more services for that money. As we all know, braces nowadays cost anywhere from $3,000 to $5,000, so that's a lot of money out of pocket, and our program is there designed to help you save money on the services that you need on a daily basis. So once again, these are ancillary benefits to help you on your day-to-day life. Also that comes with our program is a Legal Care Direct Family and a Legal Care Small Business. These services include 9 free services, which include unlimited initial phone consultations for new legal matters, initial one-on-one consultations for new legal matters, attorney review of independent legal documents. So an attorney is there to review your documents. They're there to assist you in solving problems with government programs such as welfare and insurance. They'll also give you a free simple will. They'll make phone calls on your behalf. They'll write letters on your behalf. So a lot of these benefits are free, and this is something that I know a lot of people are taking advantage of. We've also got the same thing for a small business, which includes initial phone consultations, initial letters, phone calls made on their behalf, collection letters, one-on-one consultations. Guys, all this stuff is free, which is fantastic. We've also got a fantastic roadside assistance, which is available 24 hours a day, 7 days a week. 365-day access to towing service, flat tire, fuel, battery, and lockout assistance. Covers the entire family, even dependent children up to the age of 26. We've also got an optional benefit, which is the Safe Identity. It is a proactive program specifically designed to identify identity theft in its early stages and help bring the member's identity back to a pre-theft status. Now, the solutions for employers, there's 3 solutions right now. And right now, if you guys go out there and talk to businesses or one-on-one and market to businesses, you're going to notice a couple of things. One of them is a lot of businesses are changing the way that they're doing their health care. A lot of companies recently have changed either the deductible, they've had to take some of the products out, or they're just getting rid of health insurance all in all because it's getting too expensive and they can no longer afford it. So these are our solutions for the employers. Option 1 is the employer pays for employees' health care on call benefits. The yearly cost of the employer per employee is $368. So this here is stating that the employer is going to pay the full amount per employee. So per year it's going to cost them $368.80 per employee. Option 2 is the employer actually becomes part of our company. They join and become a business partner with an $80 a year fee, and the employer pays for employees' benefits. So what will happen here is the employer is going to pay for the employees' benefits, but because they are a business partner, the employer is going to receive $140 per member back in the first year and $120 the second year, and so on. So the final year cost of year 1 to the employer per employee is only $228. Now in the option 1, it states that per employee it's going to be $368.80. Option 2 shows that if the employer joins HealthCare on call, then by them paying it and them making $140 back per member, they get a reduction in the cost, which means that instead of $368 a year, it's only $228 a year for option 2. Now option 3 states that employer who joins HealthCare on call as a business partner, which is an $80 fee a year, allows for employees to pay for their own benefits throughout the year. So the employer is not going to pay anything, but the employee is going to pay the $368 a year, but the employer is going to receive $140 per month in the first year and $120 every year after that. So option 3 states that, okay, the employer doesn't want to pay anything, they still have the opportunity to become a business partner and make revenue off of that.